Imagine waking up one morning, feeling perfectly fine, only to discover that your body is sending out warning signals you can't ignore. What if those signals were right there, hidden in your daily routine? Picture this: 6 subtle symptoms, creeping in unnoticed, that could give you a crucial edge in preventing a life-altering event. Now, let's pause for a moment. Have you ever experienced a sudden headache that felt different? Or perhaps a fleeting moment where your vision blurred? These could be more than just passing inconveniences. What if recognizing these signs could empower you to act before it's too late? As we dive deeper, remember, knowledge is power. Each symptom we discuss is a piece of the puzzle, and understanding them could be the difference between a normal day and a medical emergency. Stay sharp, stay alert. The human body is a complex system, and sometimes it whispers before it shouts. So, keep your mind open and your senses keen. You won't want to miss what's coming up next. This isn't just about awareness. It's about taking control of your health before the storm hits. Let's uncover these hidden clues together. Sudden weakness or numbness. Imagine waking up one morning and feeling a strange sensation on one side of your body. Maybe your arm feels heavy, or your face seems a bit numb. This sudden weakness or numbness can be alarming, especially if it affects your ability to move or communicate. Many people might brush it off as a temporary issue, but it could be a crucial sign that something more serious is about to happen, like a stroke. Recognizing these symptoms early can be the key to getting the help you need. It's essential to note where you feel this weakness. Is it just your arm, or does it extend to your leg as well? These details can help medical professionals understand what's happening. For instance, weakness concentrated in the face or the arm may hint at specific types of strokes. So if you or someone you know experiences this, don't hesitate to seek medical advice. Ignoring the signs could lead to severe consequences. This sudden onset of symptoms can also be accompanied by a sense of confusion or disorientation. You might find it hard to concentrate or feel like your thoughts are muddled. It's as if your body is trying to send you a critical message that something is off kilter. This feeling of not being yourself can be unsettling and should be taken seriously. Many individuals may not recognize these signs immediately, attributing them to fatigue or stress. However, it's essential to listen to what your body is telling you. If you notice any weakness or numbness that doesn't seem to go away, it's time to act. The sooner you address these symptoms, the better your chances of minimizing any potential damage. In a nutshell, sudden weakness or numbness should never be ignored. Understanding the significance of these symptoms can save lives. If you find yourself in this situation, remember that it's better to be safe than sorry. Seeking medical help could be the difference between a minor incident and a life-changing event. Speech and comprehension difficulties. Have you ever struggled to find the right words in a conversation? Now imagine that this happens frequently and affects your ability to communicate effectively. Changes in speech, such as slurring or difficulty articulating thoughts, can be more than just a moment of confusion. These challenges could indicate that something is brewing beneath the surface, perhaps a stroke on the horizon. Sometimes, these difficulties arise weeks before an actual stroke occurs. You might notice that understanding what others are saying becomes a challenge, leading to frustration and isolation. This change can be subtle at first, making it easy to overlook. However, if these symptoms persist, they warrant immediate attention. It's crucial to pay attention to these early warning signs. When someone you care about begins to struggle with their speech, it can be a heart-wrenching experience. You might feel helpless watching them grapple with words that once flowed effortlessly. This shift can alter the dynamics of communication, creating a barrier that feels insurmountable. It's essential to encourage them to seek help, as early intervention can make a significant difference. There's also the emotional toll these difficulties can take. People may feel embarrassed or frustrated about their inability to express themselves clearly. It can lead to anxiety and a sense of loss as they grapple with their changing abilities. Recognizing that these feelings are valid is vital, and support from friends and family can make all the difference. In summary, difficulties in speech and comprehension should never be dismissed. They serve as important signals that something may be amiss. If you or someone you know begins to experience these changes, taking action promptly could prevent further complications down the road. Communication is vital, and addressing these issues can potentially save a life. Changes in vision. When someone experiences changes in their vision, it can be alarming. People often report feelings of blurred or cloudy vision, or even a sudden loss of sight in one eye. These symptoms may come and go, which can make them even more confusing. It's not uncommon for individuals to dismiss these episodes, attributing them to fatigue or simply needing new glasses. However, understanding that these changes could be warning signs is crucial. The connection between vision changes and strokes is significant. The brain processes visual information, and any disruption in this function can be an early indicator of a more serious issue. For instance, if someone suddenly finds it difficult to focus on objects or experiences double vision, it's essential to take these symptoms seriously. They could be a precursor to a stroke, and seeking medical attention promptly can make a difference. In some cases, the changes in vision might be accompanied by other neurological symptoms, like weakness or difficulty speaking. This combination should never be ignored. People often think they can wait it out, but the sooner they seek help, the better their chances of preventing a stroke or minimizing its effects. Recognizing these visual changes as potential warning signs can empower individuals to take action. Education plays a vital role in awareness. Many individuals are unaware that sudden vision problems can indicate a stroke. By sharing information and encouraging open conversations, communities can better equip themselves to recognize these signs early. It's important for friends and family members to understand the implications of such symptoms and to encourage loved ones to seek medical advice if they notice anything unusual. Ultimately, being aware of changes in vision can save lives. It's essential not to brush these symptoms aside. The brain is a complex organ, and even minor changes in its function can have significant consequences. By being vigilant about vision changes, individuals can act quickly and potentially avoid the devastating effects of a stroke. Unusual headaches. Have you ever experienced a headache that felt different from your usual ones? Many people describe these unusual headaches as severe and inexplicable, often likening them to a sudden intense pressure in their heads. These types of headaches can be alarming, especially if they come on suddenly and don't respond to typical pain relief methods. It's easy to think it's just another headache, but sometimes it could be a warning sign from the body. One critical point to note is that these unusual headaches are not similar to the typical migraines or tension headaches that many people experience. They often have a different character and intensity, which can be confusing for those who suffer from chronic headaches. Recognizing the difference is essential. If a headache feels out of the ordinary, it's worth consulting a healthcare professional. Ignoring these symptoms could lead to missing out on critical early intervention. In some instances, severe headaches may be accompanied by other symptoms, such as sensitivity to light, nausea, or even changes in vision. This combination can be particularly concerning and should not be overlooked. When headaches occur with these additional symptoms, they may indicate increased intracranial pressure or other serious conditions that can lead to a stroke if not addressed promptly. Awareness about these unusual headaches is vital. Many people might brush off severe headaches as just another part of life, especially if they have a history of migraines or tension headaches. However, education about the potential risks can encourage individuals to pay closer attention to their bodies. The more informed people are, the better equipped they will be to recognize when something is genuinely wrong. In conclusion, unusual headaches should never be taken lightly. They can serve as a crucial warning signal for more severe medical issues, including strokes. If you or someone you know experiences a headache that feels different, especially if it's sudden and severe, it's essential to seek medical attention right away. Recognizing the seriousness of these symptoms can lead to timely intervention and potentially save a life. Alterecos de equilibrio e coordinaceo. When it comes to recognizing the signs that something might be off in our bodies, changes in balance and coordination can be alarmingly subtle yet significant. Imagine someone who's always been nimble, suddenly feeling a bit wobbly while walking. It's not just a case of being clumsy, it can be a genuine red flag. These sensations of dizziness or unsteadiness might not seem serious at first, but they can indicate that a person's brain is struggling to communicate effectively with the body. You might notice that simple tasks become a challenge. For instance, reaching for a glass of water could turn into a precarious endeavor, requiring more effort than usual. The once effortless act of standing up may now resemble a tightrope walk. Friends or family might comment on these changes, asking if everything's all right. Often, people brush off these concerns, attributing them to fatigue or stress, when in fact, they could be warning signs of a potential stroke. It's interesting how the brain controls every little movement we make. When a person experiences a lack of coordination, it's the brain signaling that something's not quite right. Perhaps they begin to stagger while walking or find it difficult to navigate through familiar spaces. This disorientation can be frightening, and it's crucial not to dismiss these feelings. Recognizing that these symptoms could be early indicators of a more serious issue can be life-saving. Even more concerning is how these symptoms can come and go. One day, a person might feel perfectly fine, and the next, they're struggling to maintain their balance. This unpredictability can create anxiety, making individuals hesitant to engage in activities they once enjoyed. The fear of falling or losing control can limit their social interactions and overall quality of life. It's a cycle that can escalate quickly if not addressed. Awareness of these changes is vital. If someone notices a persistent sense of imbalance or coordination issues, it's essential to seek medical advice. Early intervention can make a significant difference. The conversation about these symptoms should be open and honest, as they could very well be the body's way of signaling that a stroke might be on the horizon. So if you or someone you know starts feeling a little off balance, don't wait it out. Getting checked out could be the best decision. As we wrap up our deep dive into the 6 warning signs of a stroke that can show up a month before it strikes, let's take a moment to reflect. Recognizing these symptoms can truly be a game changer. Imagine being able to identify subtle changes in your body or in someone you care about, like sudden fatigue, mood swings, or even slight speech difficulties. These are not just random occurrences. They could be your body's way of signaling an impending stroke. But here's a thought. How often do we dismiss these signs as stress or just getting older? It's crucial to pay attention. So ask yourself, do you or someone you know experience any of these symptoms? What steps can you take today to prioritize brain health? Remember, knowledge is power. Share this video with friends and family. It could make a difference in their lives. And don't forget to like and subscribe for more vital health tips. We want to keep you informed and empowered. So, what's your next move? Are you ready to take charge of your health? Let's keep the conversation going in the comments below. Your health journey starts now.